All this partisan ideological fog, it makes it difficult to see the facts. But if we can cut through it, we would see a way to provide health insurance to 1 million Texans, add $2.5 billion to our state budget and $2 billion to the budgets of our local governments. At the same time, we can stabilize family finances, we can reduce smoking rates, improve overall public health, provide vital support to our rural and urban health systems. We can lower local property taxes, improve racial equity, boost the economy, create jobs, promote employment, all of this through Medicaid expansion. Despite all these benefits, Medicaid expansion, which is really just Texas drawing down federal health care dollars at a 90-10 match, something that 38 states have already done, they're already benefiting from it. That decision still faces significant obstacles in Texas. Some of them are political, some of them are practical, some of them are philosophical. But in this video, we're going to learn some facts. We're going to learn the facts which, if are known far and wide, they help us cut through the ideological fog, overcome the inertia that is holding Texas back, stopping us from doing the right thing for our people and the right thing for our economy. Let's back up a bit. What is Medicaid? And why do we need to expand it? Medicaid is a partnership program between the state government and the federal government to provide health insurance to people who can't afford it. Unfortunately, Texas holds the ignominious distinction of having the most people and the highest rate of people without insurance of any state in the country. As you might expect, this leaves a lot of people out. Who are they? Who are the expansion enrollees? Overwhelmingly, we're talking about the working poor, frontline workers in low-wage jobs. They might be between jobs, but they do not earn enough to be able to afford health insurance, which means they can't afford health care. And if they can't afford health care, where do they go for their health care needs? The only place they can go, the emergency room. That is the most expensive setting possible. And that cost is crippling our local health systems, especially in rural districts where hospitals have closed in Texas more than they have anywhere else in the country. There are broader economic consequences as well. Texas has already lost billions of dollars by not expanding Medicaid sooner. Leading Texas economist Ray Perryman estimates that had Texas expanded Medicaid in 2019, we would have generated more than $20 billion in gross state product, $14 billion in additional personal income, and about 230,000 jobs. The basic program is pretty simple. Medicaid expansion covers adults ages 19 to 64, kids or no kids, earning up to 138% of the federal poverty level. Experts estimate that about 1 million Texans would qualify for and enroll in Medicaid expansion. Now, Medicaid expansion is different than our normal Medicaid program in a very critical way, and that is that under our normal Medicaid program that we have right now, the federal government puts in $60 for every $40 that the state puts in. But under Medicaid expansion, for that 1 million new people, the federal government puts in $90 for every $10 that the state puts in. Pretty good deal. It's such a good deal, in fact, that $10 we put in, we make it back. It ends up not costing us any money. This is such a good deal that 38 other states, all but 12 states in the nation, have already expanded. And you know many of them have gone back and said, not a good deal? Zero. Well, let's draw. 0 states have gone back on it because it's a good deal and it works. With 38 states having already done this, as a Texan, I'm kind of starting to feel left out. All right, you remember that $10 we were talking about with the 90-10 federal state match? We really do have to put in the $10, but we're going to get it all back and then some. Before I explain the whole thing, I want you to understand, appreciate, this isn't out of my head. This is not wishful political thinking. This is the product of expert analysis over the last 8 years. Multiple economists, multiple experts have looked at this over time using different data at different times, using different methodologies. They come from different sectors, the private sector, the public sector, from academia, all looked at this question about Medicaid expansion and come to the same conclusion. It makes money for the state. Let's take a look at how that works. The basic formula is pretty simple. Savings plus revenue is greater than costs. Cost is the easy side of the equation. That's just how much it costs to provide health insurance to 1 million Texans. That's estimated to be around $1.3 billion per budget cycle, which in Texas is 2 years. The savings for that same period of time is about $1.2 billion. The revenue from that period of time is about $0.2 billion. Those two add up to $1.4 billion. Let's take a look under the hood at what these things really are. The savings part of this, only under federal Medicaid expansion. It's the only deal where you can do this. There are certain programs, health programs, that the state pays for with state tax dollars that will be paid for by the federal government if we take the 90-10 match. Those programs include prisoner health care. They include certain local county mental health programs. They include programs for pregnant women, many other programs as well. But collectively, the federal government's going to pick up the tab on that. We save all this money. On the revenue side, because in Texas, we partner with the private sector. Every person insured under Medicaid is a separate health insurance policy. Every health insurance policy pays a very small tax. That little tax on 1 million new people in the Medicaid program adds up to this $200 million. So you see, together, we're actually pulling in more money than we're putting out. Here's the really cool thing. This is on a static basis. Static basis means we're not taking into account the fact that when, again, under the ACA expansion only, if we do this deal, the federal government sends $11 billion right into our economy, $11 billion that isn't in there right now. Anytime you inject billions of dollars into a state economy, it generates economic stimulus, which generates state revenue. The estimates are that $2.5 billion more dollars will be raised in state tax dollars without putting a tax on anybody if we take this deal. And $2 billion in local revenue. Who wouldn't want $2 billion of local property tax relief as a result of giving insurance to 1 million people? On the dynamic basis, $2.5 billion. On the static basis, $100 million is at least a break even. Pretty good deal here, folks. If anybody tells you that we can't afford to expand Medicaid in Texas, show them this. Medicaid expansion helps families. It helps businesses. It boosts our economy. It adds money to the state budget and the whole host of other benefits that we've already talked about. What is the holdup? It's political inertia. Do Texans not want to expand Medicaid? Do Texans not want to bring their own federal tax dollars back to our state? Of course they do. In fact, in polling, 2/3 of Texans have said they want to expand Medicaid, even using those politically supercharged words, Medicaid expansion. The problem is that there are problems that aren't really problems. That is, there's stuff that people thought was true that isn't. There are things that people thought were going to happen that didn't. Let's take a look at a few of them. For a long time, the biggest objection was money, that Texas can't afford to expand Medicaid. But as we've seen, it can, and frankly, people have pretty much stopped saying that. So now the objection is, but what if Congress pulls away that magical 90-10 match that makes it financially viable? That doesn't work either. And here's why. 38 states have expanded Medicaid. That's 3/4 of the United States Congress, representing 228 million people with 53 million expansion enrollees. What member of Congress is going to go back and say, hey, constituents, guess what? I've increased the number of uninsured in our state and I've decreased the amount of federal money that's going to go into our economy? Nobody's going to do that. Another frequent objection is that Texas would be forced into participating in a broken federal system. But the fact is, it's not broken. The fact is, it's working quite well across the nation. That's why 38 states are already participating and none are going backwards. But at the same time, let's take it seriously. There is a great deal of flexibility today, more than there ever has been, so that Texas can craft its own Medicaid expansion solution for our population, for our institutions, that works just for us. Medicaid expansion can be a bipartisan success, or it could be a partisan failure. And when we get into partisan struggles, there's this temptation to say, let's just compromise. Let's do a little bit of what you want, a little bit of what I want, a little less than full expansion. And you know what? We can't. And here's why. Because anything short of a full ACA expansion will cover a tiny fraction of the people who we need to cover, of the people who we can cover with a Medicaid expansion, a full Medicaid expansion. The other problem is that all these alternative models, they're 60-40. That is 60 federal dollars to 40 state dollars, whereas Medicaid expansion is 90-10. And remember, that magic money math is the key that makes it make money for the state. If it's 60-40, it costs money for the state. And if it costs money for the state, it's not going to pass out of the Texas legislature. And if it doesn't pass, we're right back where we started. In other words, folks, it's 90-10 or failure. We can implement a Medicaid expansion in Texas our own way, but we've got to implement a Medicaid expansion in Texas. There is still a lot of partisan ideological fog out there. If we're going to pass Medicaid expansion this session, we need you to help us clear the fog away. Let's deliver a clear, urgent message to the people of the state of Texas. Republican, Democrat, urban, rural, everybody. Medicaid expansion works for people, it works for businesses, and it works for the state of Texas.